Well, we were not going to do this video today because of we felt like people were trying to focus on how they were going to adjust back into the work world. And then I noticed this week that there was a lot more traffic out. And like downtown right now looks like just like a regular Friday night. There's traffic both directions. There's taxi cabs carrying people and dropping people off. And there's people waiting outside restaurants, all crowded together. The beach, when I left the beach this morning at 6:30, all the parking lots had cars in them. The parking lots down for Pickens Road were 3/4 full, all the public beach areas, at 6:30, 6:45 a.m. Like a Blue Angel kind of situation. And then by noon, all those parking spots were full. The Casino Beach was about, I'd say, 3/4 full by noon, which is unusual on a weekday. The cars parked on top of each other, basically, like this close to each other. And we've got, I'm not sure what's going on the beach. There's one sign that they see when they drive onto the beach bridge that says, "Please try to keep social," and then it has distancing on another page. I don't know that there's any other warnings. Maybe there are once you get to the boardwalk at the beach, and maybe there are little signs or something out there, but I don't know how they're going to enforce that. I don't know if the lifeguards are out there like segregating people, or what they're doing, but I'm concerned about that. The other thing that concerns me, and this is what we do mainly, is these car wreck cases. I'm very concerned about the traffic because traffic has been, I can tell you, I was in the Destin office this morning to meet with a new client, and I would have thought that it would have been, traffic wasn't like a typical summertime day, but it felt like a typical spring break day, and people were everywhere. And I'm not sure how people could physically socially distance under these circumstances. The grocery stores, of course, are always packed on Fridays, but Destin looked like it was a typical holiday kind of weekend. So not necessarily summertime holiday weekend, but maybe a springtime holiday weekend. It didn't look unusually sparse. And on top of that, I think people are driving a little crazy, to be honest with you. I think people are not paying attention. They've been pent up at the house around the same sort of people, and they're ready to get out and do something and roll their windows down and park the car and have fun. And I don't blame them, number one, but it's not exactly conducive to the safest driving techniques or methods.
They haven't driven in a while.
Well, I mean, I don't know if it's that, as they hadn't driven, out a ways. Maybe they've driven around back and forth to the grocery store and back, or they've driven to, down the street to get to the Walgreens, or, and maybe they hadn't driven a lot at all. But once they get out on the bridge and they get out on Highway 98, I was on 98 twice going back and forth from Destin today, and it was a mess. It was a lot of people out there, and everybody seems a little bit on the road rage side of things. And it's concerning to me because we've had a respite from car wrecks for about 7 weeks, in large part, and now I feel like that people are getting crazy and they're throwing caution to the wind, literally. And unfortunately, it's I don't know. I'm worried about our weekend from a car wreck perspective. It concerns me, but I did want you to maybe just tell people again, number one, this isn't over. Our numbers are not really that different than they were a week ago. If anything, there might be the same or worse. When you factor in the nursing facilities, long-term care facilities, it is worse than last week. So what would you tell folks? You can't keep people from going to the beach, and I get it, but you can't just forget about this. You just can't. And it seems to me, looking at Palafox and watching the traffic along Ramona here, that the cars are all parked all the way up and down the streets, and it just seems like I think people have said it's over. and I'm not sure they got the whole message that it's not quite over. But what are your thoughts?
Basically what you said there, I reflect the same thing where, think about all what we just went through, and keep that in mind with any of your interactions with people, even people that are coming and going from your home. Keep in mind where maybe they've been. So they're basically bringing home to you wherever they've been. So there's 1 weak link. That's what's happening in these nursing facilities, where there's something being brought in to these people that are residents there. And so think about that in your own abode, and exercise some caution. So it's washing your hands first thing when you get home. You may have been out there contacting other people. Keeping the hand sanitizers around, and limiting any like socialization. So you haven't seen some of these people. Let's say you are at the beach, you haven't seen people in a while. It's okay to wave at them and then keep going. You don't have to go up there and give them a hug and shake their hand and all that. So I would urge that, and just take this opportunity to say, hey, I've been hanging out with my 2 or 3 close family members at home for the last month and a half. Now we're going to go do the same thing. We're just going to be able to do it at the beach now, which is a blessing right there. And take that, and I mean that's it. So I mean, that'd be my first recommendation. My second one is, don't forget that if you are symptomatic, you need to be tested. So there's plenty of test facilities in the area now. So don't be too busy enjoying the beach or doing all those other things you haven't been able to do because you're compensating for that right now. Don't be too busy to get tested and to be mindful of your own health, because you don't want to be the next statistic of, well, he was always healthy and he didn't think he'd get infected, and all of a sudden you're laid up for however long. And hopefully that's all it is, just laid up, not hospitalized.
All right.
So be mindful of that.
Next Mondays would be the beginning of our 8th week working remotely. But what we're going to do is we're going to bring in some of the staff. But what we're doing is we are first screening everybody without getting into their private health information. We've asked them just to tell us if they have any of the risk factors. And we had several employees that did say they had risk factors. And if they have a risk factor or they're in a house with somebody that's a high risk group, then we've basically exempted them from the coming in at all. And then the 2 or 3 people that are coming in shifts are going to operate on with all the social distancing things. And we're going to, I think, post a link to what we're doing as an office to not only create distance inside the office, but to also, once the people are here, to make sure that surfaces are cleaned on a regular basis, that temperatures are taken and recorded on a regular basis, and that we keep a handle on, once they're here, that nobody from the outside is bringing germs in. So we came up, I think, with a checklist on Wednesday or Thursday of this week, Dr. Malone, and with your medical influence and my legal influence and some of the other input from the other folks in the office, we came up with this list of things. And again, this doesn't include anybody that's high risk. So the people that are high risk are actually going to stay put in their houses. They're not coming out at all. We're coming up with different parking places. We're coming up with different, the walk from their car to the door is different. Which door they're using to the office is different depending on where they're going in the space. They're staying pretty much in their space. We're bringing lunch in. We're not having people go out to lunch.
They're only using their own workspace. And then
anyway, the list will be online. We'll put a link to it. You're welcome to plagiarize the heck out of it or critique us and let us know what you think we're missing. And then was there anything else you wanted to talk about, Dr. Malone, in regards to the COVID stuff locally?
So luckily, the only other news was that we did have, if you remember earlier in the week, there was the mention of Southern Oaks had the 94 diagnosed cases, which was the number 1 in the state at the time, and if not one of the number ones like in the entire country. So as of this morning, Southern Oaks is still number 1 in the state. However, we also have number 3 in the state, Bayside, and so that's a facility that's got a capacity of about 120 beds, and they have 44 residents who are positive and 13 staff members who are positive there. So Escambia County per capita is definitely got a pretty heavy load of the long-term care facilities in our.
What's Bayside's?
Pardon me?
What's Bayside's address? This
They're at the corner of they're at the corner of Langley and Spanish. So they're
Yeah.
Langley Avenue. They're right at the top of the hill as you're coming up from Scenic.
Okay.
So yeah, so it's actually I guess in the neighborhood of the airport, if that gives anybody some perspective.
Right.
Those were the big things as far as locally. We still have a lot of long-term care facilities that are being impacted here locally, and staff members equally so. And you would argue that that's probably where one of the links is that's bringing this infection into the facilities. And then number two, the state released the death data as far as long-term care facilities for the first time. And so there are 4 deaths tied to Southern Oaks and 4 deaths tied to Brookside or Brookhaven, I think. That's up by West Florida Hospital. And so 8 of the 12 deaths in the county are tied to long-term care facilities.
That's unfortunate.
Yeah, so I mean, it goes to show you that that's the exact reason why this caught my attention a couple weeks ago when they started releasing this data, and I think that's why people should be concerned for that. So if you're not going to listen to anything we said at all today, be mindful of where you take yourself if it includes any of those facilities, whether it's visiting someone, being close to someone who's visited there, you name it. So if you're going to social distance anywhere, have it be there.
All right, and then on the whole careless driver thing, drinking and driving, I just feel like there's going to be a lot of that this weekend. I want everybody to be very extra careful in regards to that. If you find yourself drinking, don't drive. If you find yourself around somebody that's drinking, don't ride with them. And if you end up in a situation where you get hurt by one of these folks and you need somebody to talk to about it, we're here for you. You can find us on the web at zarzaurlaw.com. You can always call us at 855-HIRE-JOE. Hopefully everybody will be safe this weekend. Just go to the beach and find yourself a nice area where nobody's within 6 or 7 or 10 feet of you. And if they're coughing, you want to be further than that, by the way, or sneezing. Remember, we went over this. Sneezing actually projects it further than coughing. So if somebody's sneezing and they're 6 feet from you, you're about 15 feet too close to them. So.
And then being outdoors is not necessarily safer because the whatever's in the sneeze has the wind on its side too.
Right. So if the wind is blowing towards you and somebody sneezes out in front of you, guess what? It's coming right to you. And the hell with the 6 feet. I mean, that's not going to do anything for you. So keep all this in mind, folks. Let's stay healthy. Let's get this thing beat. And if you need us, we're here for you. Take care. We'll see you next week. Thank you, Dr. Malone.
Yep, bye now.